That's the
Chimafidi non kotu era one radio. Samupe jumpe dietia. Chimafidi non kotu era one radio. Oh, ayum pamchuma. Chintu asam pamchuma. Chintu agratum chuma. Era one.
Hello, good evening, Era One radio listeners and viewers all over the world. It's another Saturday evening, the day preceding Mother's Day. It's the 11th day of May, 2024. And of course, when we meet on this platform, which is themed Health is Worth Protected, your health is your worth. If you are healthy, then you are worthy, because you may have a room full of money. If you are not healthy to enjoy it, don't forget it. Somebody will do that for you. So stay in health and be in wealth. Well, tonight is another edition of the Era One broadcast. We're broadcasting live on Facebook, YouTube, and also Modern Ghana Radio. A few weeks ago, we started a series on health. We captioned it Know Your Numbers, the relevance of laboratory results for effective diagnosis. And we are doing the part 2 today. Actually, according to my co-host and my guest, Dr. Yolade, he had actually advised that we're supposed to do this in a series of 4, but for some reason, you know what happens in this country. Sometimes you propose and God disposes, so you may not have all the Saturdays to do what you want to do. I mean, graduations are coming, events take place. So we apologize for not being able to follow up. But then this week, he said, no, we have to come back because we promised our viewers and listeners that we're going to come back and continue this series. So tonight, we are getting on with part 2 of Know Your Numbers. When we say know your numbers, what does it mean? Of course, some of you missed or dodged mathematics classes. When they mentioned dy dx tending to 0, you asked what is that differentiation, you had no idea. When they mentioned Pythagorean theorem, you were running away, and so you avoided maths. But realize that in these days, everywhere we go, math is applicable. If you're going to get a new house, you have to know your numbers. Apart from the money they ask for you to put down or pay for the cost of them, whatever, your numbers is very important. If, for instance, you have to know your credit score. It's very important. If you don't know your credit score, you go for a mortgage house and they will give you a percentage like 10.1, 6.8, 5.2. If your score is good, that is, if your credit score is in the 800s and 900s, then you know you're going to get a very reduced interest rate. So knowing your numbers is very important. In the health area too, you have to know your numbers, because as a chief scientist, if Dr. Olede tells you your sodium is, let's say, 140 or your potassium is 6, then you have to know where you stand. If you have a potassium of 6.5, then you are getting ready to join your ancestors. So you have to know your numbers. We'll go into more details. But before I do, I will have to do the honors of welcoming my co-host, my guest, Dr. Babatunde Oloyede. Doc, you're welcome.
Good afternoon.
Good afternoon. Good evening.
Thank you for having me too.
You're welcome. All right. What's trending in your neighborhood?
Well, I mean, it's like you said earlier, on a graduation this weekend, and some family members and also friends and colleagues, invited us to their, graduation ceremony. So I have to, excuse myself since I know that we'll be joining this evening. So instead of going, I asked my wife and my daughter to represent us. And that is why I'm here now.
Wow. That is awesome. Thank you very much. I mean, I apologize for making you skip that August event, but well,
that's okay.
We appreciate it. We don't take that for granted at all. Well, on my end, of course, tomorrow is Mother's Day, and I know Doc's mom is around, so he has to show appreciation. Unfortunately, my mom passed away as way back as 1986. That's a lot of years ago. I was still young. And just today, so you see me clad in black and some colors, because in Ghana, black means you are mourning. So today, actually, I'm mourning. Just before I came to the studio, actually around this afternoon, my cousin, the one whose mother follows my mom by birth order, that's my mother, was the one that came before his mom. News reached him that the mom has just passed away. So that is some bad news for me and
Sorry
for
to
her.
hear
Yeah,
that.
because that's my immediate aunt, and tomorrow being Mother's Day, it's rather unfortunate that Joe is going to miss the mom. Missing her is another thing. And missing her just before Mother's Day is also another issue. So for those of you who still have your moms around, please do some appreciation. It doesn't matter whether they spanked you when you were a kid or you are not talking now. It doesn't matter. Just take a moment and call them and wish them a happy Mother's Day, because you can have a wife and your wife might even run away or divorce you, or you can leave your wife. You can have more wives, but you only have one mother. So the mother you have to appreciate. So Joe, if you are listening to us, our condolences to you and
Yeah.
your other siblings. All right, so we're going to zoom into our topic. As I was saying, knowing your numbers is very important, and of course, Doc knows the importance of doing your annual physicals, doing your medical examination, your labs, and everything. I just did mine last weekend. He is a March born, so by PHS virtue, you have to do yours a month before or the end of that month. So I believe he's done his own. I just got mine and I have to send it to our office by uh, next week. So it's very relevant that you know your numbers. You go for your annual checkup. One thing we find about African people is that they hardly do that. They wait till a situation creeps up before they go see their doctors. That is not a very good advice. Please, it's imperative that you see your provider, your doctor, every year. I mean, it used to be 5 years for it, but now they realize that no, 5 years was too long a time to wait to know what is going on in your system. So they put now we have to do it every year. I was talking to a mechanic just 2 weeks ago. I was discussing the importance of colonoscopy. He said, "No, I can't do that. I can't go for somebody to stick their hand in my rear end." And I said, "So you're going to wait till you go after 7 years and they realize that you have a lot of polyps in your intestine. You are about to have a colon cancer before you realize the importance. Please do." This guy wouldn't listen, but I'm sure one day somebody's going to tell him the relevance of having all this, checks. And when you're at a certain age, of course, now between 45 and 50, you have to do your colonoscopy. They have to see what is inside you, whether it's a woman or man going to stick his fingers or her fingers in your rear end. It's important because whatever they discover early, it's for your own advantage.
For your
All
good. Mm.
all right, so we did know your numbers a few weeks ago, as I said, and we discussed very important factors. And today we're going to continue. Dr. Lloyd is going to lead us in why we do certain labs, especially something like BMP, basic metabolic panel. What does that mean? And why do we need that? He's going to explain to us the relevance of that. Another test, because you realize that there are certain tests that even if you don't do anything now, there are some basic things that you have to do, like A1C. You have to know your A1C, your sugar level, whether you are prone to diabetes. You have to know your cholesterol. And for those of us, of course, both of us from Africa, we like to eat certain food. And I know Doc said he's reduced the broccoli, but I know every now and then he will hide and still go and eat it. So it's something that we enjoy, but then it's not very good for our health. We have to try and curtail it. So you have to know what these food elements do to your body. I mean, they keep telling us that all of us should be eating salad morning, afternoon, and evening. But how can you become a goat every day? Sometimes you need to eat some. You want some very good food to eat, so you go to the restaurant tomorrow, Mother's Day. The whole restaurant area is going to be full. People are going to meet. They're going to eat the barbecue ribs and everything. I know that some people are going to gain like 5 pounds tomorrow, and then the following day they run to the gym. Anyway, so Doc, we're going to continue with our discussion on knowing your numbers, the relevance of knowing what these lab results impact of you. And I think we did state earlier on that doctors can't do everything. They cannot diagnose all the diseases unless we, the lab scientists, help them, because they can do so much by looking at you. Maybe they can look at your eye and say, okay, the color of your eye is changing to yellow, you are jaundice, and a few things. They look at the way you walk, maybe you are limping to the left side. They can do a few, but then most of the diseases, the chronic ones that we experience, come from the blood. That is why even the Bible says that the life of every animal, every human being is in the blood. They have to draw your blood and put it under testing, whatever, and know what is there. Otherwise, because sometimes some people even have HIVs and nobody know. They only know when they draw your blood and see what is there. Some people, the external manifestation, the symptoms they display will tell them, oh, you have this disease. But some things, some disease, they will not know until it comes from the lab
Very
results.
late.
So, Doc, I've talked for a while. I'll let you also talk.
Yeah.
Yeah, give us the information for today.
Thank you so much. Thank you so much for having me.
You're welcome, sir.
This platform is a very, in short, it is a very informative platform, and I believe we'll continue like this because if you don't know, uh, I mean, let me put it this way: what you don't know may kill you,
Yeah, can hurt you. Yeah,
but
that's true.
what you know might not be enough for you to understand what you don't know. And that is why we have to, bring some information out and let people understand what is actually, entails in our lives and things that we should know as individuals if we are going to see your clinician. It's very important for you to be knowledgeable about what you are going to, ask, and also what they are going to give you, and how you can address yourself and see how you can use that information to help, you know, your own healthcare, management. Basic metabolic panel, as many people will know. I know some of us might not have had that before, but if you have been in hospitals and they've taken your blood, for analysis, and doctor is saying that, well, until the result comes, he can or she can do anything. Uh, in that case, I mean, what is actually going on is they want to find out what is happening in your system, because since a doctor is not a juju man, so he can't just look at you and see what is in you. He has
Predict.
to he has to ask for the lab to give him, whatever it is that is in your system. So a basic metabolic panel is actually comprised of 8 different tests together. They are going to measure glucose, they're going to measure calcium, in your blood. They're going to measure sodium, potassium, carbon dioxide, chloride, and your blood urea nitrogen, and of course your creatinine. See, these different, you know, uh, solutes in your blood, as it may, they are doing different things. They are doing different things. Of course, if somebody doesn't have enough sugar in their system or glucose, we know what is going to happen. The person may collapse, because brain feeds on glucose. Your brain feeds on glucose. So we have calcium also. Calcium is rudiment to some of the neurologic, activities in the body. If your body lacks calcium, then you may be having some issues also. Sodium, potassium, and carbon dioxide are also in your system. So the levels of this actually is what are being analyzed when they take your BMP, which is called basic metabolic panel. And you want to ensure that when taking that blood, it shouldn't be lysed. If you notice when your blood is being taken and you know that they are having issues in drawing your blood, please, I will say that again, please let them know that you can, be redrawn if the blood is not good enough. The reason why I say that is if your blood is taken and is hemolyzed, what is going to happen is, I believe in the lab, they probably will tell you to come back for a redraw, because the value of your potassium will be over the roof and perhaps your glucose may be low. So you don't want this situation with your sample, especially when the doctor is waiting for the result, before they can give you any medication. So if the result is not accurate and they prescribe a medication based on that, is going to give you another, issue going forward. So another thing I want to mention here is, you see, what do the results mean when you get it? What is the meaning of the result when you get it? So I want to say here that if any one or the combination of BMP results were not normal, it indicates a number of different conditions. Like I said earlier, this includes kidney disease, breathing problems, that is if your CO2 is low or is way high, and complications related to diabetes, more tests may be required by your clinician if they see this happening, because clinician also must follow the rule. That's something that they use in their diagnosis. So if any of this, for any reason, is out, in order for them to rule out a specific diagnosis, they have to, order more tests and find out which of the, variables they are looking for at that particular time. So, like I said earlier, it involves, your BMP involves glucose, calcium, sodium, potassium, carbon dioxide, chloride, blood urea nitrogen, and creatinine. I believe as we go along in this program, we will talk more about each and every one of those. But your kidney functions is very important. Your liver function is very important. But today we are, zero in on kidney functions, which will help us, and that is why we've selected the BMP, which is basic metabolic panel. I believe maybe next week, if we have more time, we can go into CMP, which that is the comprehensive metabolic panel, the one that combines other tests to it. All right, I'll stop here and hear if you have any question or any follow-up question, comments, or feedback. Thank you so much.
All right, thank you very much, Doc. I mean, Doc was my mentor when I was doing my PhD. In actual fact, he was the one that motivated me to enroll in Warden when he was already there. So he, of course, graduated or commenced before me, but he was a very instrumental part of my earning my PhD in Warden. So he's my senior man, so I respect him so much. And he's also the chemistry guru, in charge of the chemistry department in the Federal Medical Center lab. So he knows what he's talking about. And he mentioned something about glucose being very important for your brain. But the funny thing about nature is that some of the things that are very good for us too, when you have it too much too, it becomes a problem. The thing is good for you, but if you abuse it and you have too much of it, it will abuse you or it will hurt you. So it's very important that we know some of the, that's why in lab, we have something we call reference range. So we'll be talking about understanding your lab results. In actual fact, this lab topic that we are doing is very, very broad. It will take us the whole year to finish because the BMP is a sub of the CMP. The tests within the BMP are less than the CMP, as he mentioned before. He said there are some more tests added to the BMP to make it a CMP. So there's more that we have to cover. And beyond that, apart from the chemistry, in the lab, we have the hematology department where we also do the CBC, where they count your blood cells. So lab topics are very broad. It will take us the whole year to, finish. And it's very important because some of you go to the lab, one, you are scared of getting your blood drawn, and two, you have no understanding of your lab. So we're going to make a detour. Doc, how do patients or any of us going to the clinic, how do we understand our lab results? What is your advice for patients understanding their lab results? What is the approach?
Well, what I would say is it's very important for you to know what the reference ranges are.
Good.
And one thing I probably will say here is that since reference ranges should be universal, especially in the US here, they're using the same, unless the instrument that is being used is different from, and that is why when we do all this CAP survey, they want to match results with other labs and see which one is common, and that is what they go by. So but it's also good for you to have a baseline. What do you think this value is supposed to be?
Okay.
So if you know the baseline, and your baseline, for example, glucose, your baseline might be 100, that is for you. and they say is between 85 and 120, for example, and your own is 100. Just know in your mind that that is what your body will measure at a particular time. And it's just like somebody was telling me recently about the blood pressure curve and what I mean. We'll go to that maybe later on in this our journey. But sometimes what you measure might be different from your counterpart. The thing is the way your body is built and what your body has been used to. Like somebody that eats gari like every day, somebody that eats salad.
Totally
And
different.
it will be very different, So the values that the both of them will measure when you take their blood will be different. It's not necessarily meaning that the person is sick, but it's just that his body is uh, uh, been set to that range. And when you now compare with a normal value, and you now see that the person is off, a little bit, or maybe is even you know, tending towards, somebody that is going to be healed. So that is why you have to keep that in mind. So know your values, know what I mean, when you go to the hospital and they give you your result, make sure that you know what it says. I mean, that is pertaining to you compared to others. Know your own set value. Uh, Not necessarily meaning that is abnormal, but just know what it says. Because, for example, if your blood sugar, like I said earlier, measures 110, and maybe you now go back next time and is measuring 125, or maybe it's now close to 150, something is wrong somewhere, because you already know that it's always 110. Whether you eat gari from now till tomorrow, is been 110. But now when the value is now for some reason is higher than that, then you know that something is wrong. So you have to take care of that as soon as possible before it's over the roof. Now I'm
Wow.
going to give you some numbers here, reference ranges, which
Okay.
I believe we should know, as maybe a novice going to the clinic. At least when they measure your stuff, you should know at least what's the range. I mean, of course, some lab results will come with the ranges on the side. You see the reference values. This is the reference. I mean, this is what they think should be. I mean, and they have values like that. They will have the lower value and they will also have the high value. If yours is in between, then you know that at least you are in between. At
You're
least it's
safe.
not abnormal, and that you are in that. For example, I'm going to give you like chloride, for example, is between 96 and 106 milli equivalent per liter. Okay. Now, your creatinine, depending, it might be adults and it might be children. Okay, for adults is 0.6 to 1.2 milligrams per DL, and for children is 0.2 to 0.7 milligrams per DL for children. And I talk about sodium the other time. The normal range is 136 to 142 mil equivalent per liter. Okay, I think I talk about glucose. Before glucose, let me give you blood urea nitrogen, because I believe I spoke about that too earlier. 8 to 23 milligrams per DL for adults, and children should have lower if you have that. Carbon dioxide, 22 to 28 milli equivalent per liter. And you see that. So glucose, like I said earlier, even the reference rate here is even more more close. 70 to 110 milligrams per DL. See, 70 to 110 milligrams per DL.
Okay.
So if you have this at the back of your mind, when they present that result to you, what should come to you, I mean, naturally, is, am I within these ranges? if you are not within those ranges, then you need to be talking to your clinician. You need, whether it's lower or higher, you need to be talking to your clinician. Now, don't take some people will take action into their hands, like they do in some part of the world. They'll go to a chemist for them to issue them some medication for them to be using. Those things doesn't work. It's either it puts you to sleep on time, or it may even compound your problems. So the best thing is for you to talk to your clinician and let them give you an advice what you need to do differently. Some, they may say, okay, you have to be taking this type of food for a certain period of time, or you may have to go for other tests to ensure that some of your organs are not misbehaving. So that the combination of all those information is what they now use to prescribe a medication for you.
Wow.
I'll stop here.
All right. Thank you very much, Doc. This is very insightful. This is good knowledge. I mean, we always applaud doctors for what they do, but behind the scenes, what doctors are doing are the lab technologists, technicians. We provide a result, but because we are not upfront, you guys don't appreciate what we do. The glory always goes to the doctors, but the doctors should also know that without the laboratorians, they can't do what they do. Because if I tell a doctor that I ran a patient sample and his potassium is 6, that is danger, a dangerous situation right there. So the doctor is going to do everything possible to bring it down. Or for instance, if I run a test and tell the doctor, oh, your patient's sodium is so and so, it prompts the doctor what to do. And so we as the lab people also have to do our job with what? With integrity. You cannot just assume, you cannot copy. And so some of you have been copying from your classmates and your friends since you were in kindergarten. So you think everything should be copy. Even when you go to the lab and they give you, let's say, your cholesterol as, let's say, 200 and something, you don't want the doctor to know that your cholesterol is high. So you want to go and copy your friends who has a cholesterol of 150 or 120 and so, dog, this is my cholesterol, I am good. No, you do that, you are shortchanging yourself, because the doctor has to prescribe medication for you based on your lab results. So if he's looking at something that is high for you, he's giving you a medication that will mitigate it. Now, if you present something that is false, that's what it's going to do. We'll talk about false positive and false negatives. It's very important. So it's very imperative that you know your numbers. That is what a doctor is going to use. And Doc said something about the lab results in terms of, let me just make this example, concerning twins. Twins are maybe kids or who came with probably the same genetic code or genetic, constitution. But even them, if their genetics may be the same, but the phenotypes may be different. When we talk about phenotypic expression, we're talking about what is outside the environment, what the environment produces. So if you take twins and you raise one in Ghana and you raise one in US, you realize after a time, when both meet at the age of 10, 12, or 14, you realize there'll be some difference. Why? Although their genes are the same, the environment has acted upon them differently. The food they ate made them different. So if you subject these same two people to lab testing to draw their blood, realize that although they were twins at birth, one maybe by eating good food here or there might produce different results. So don't think that this is where one size fits all. It does not. You and your spouse may never have the same results. You and your brother may not have, your genes may be similar, but then the way you carry yourself. And I read someone when I was doing my program, PhD, one author said what? Genes is like, a gun, the genes are kept in the gun. They are there in it. They cannot fire. But the trigger, when you press the trigger, that is what releases the ammunition or the bullets. So the genes are intact in us. They don't manifest until they are made to. And the environment acts on these genes to manifest who you are. I mean, look at me and Babatunde. We have different weights, I believe. Maybe he eats less bokoto than me, or I do more than him. We are totally different. The food we eat determines how you are. So if you see somebody on the street and one person weighs 120, another weighs 190 or something, it's the environment and the way the genes is playing a part, but the food you eat and the way maybe lack of exercise also display what you end up being. And I just want to reiterate what he said about the the test results. I mean, I just did mine, so I have my copy with me. When you go to the doctor or the lab and they give you your lab results, don't just walk away. Please ask questions. On your printout, you see something like the test name. What did they test? What results did they give you? What were the units that were measured in? And Doc mentioned the unit, whether it's mg milligram per dl or whether it's millimole per liter, whatever. You have to understand. I know, as a layman, you may not understand what this means, but take time to ask your laboratorian or your doctor, what does my results mean? Sometimes they'll tell you, I mean, I do inspections and I go and they are measuring the blood pressure of some of these donors. They get a value. They don't even bother to tell them, oh, donor, this is your blood pressure. Oh, you are in good range. Please ask whoever is taking your blood or taking your blood pressure, what is my results? Know your numbers, know your results. So next time when you go, you know what it is. So like I was saying, the results will give you what the testing, for instance, glucose. It says glucose, and it gives you the reference range. Dr. Lloyd mentioned the reference range. I have here like 70 to 99 is the reference range for glucose. And may I add that sometimes too, the instrument that the organization uses, the firm might be different. So if let's say I go to Fort Lee or some hospital and the instrument they are using, whether it's Abbott equipment or Galileo or whatever, their range may be set to 70 to 99, but his lab may be maybe 71 to 76 or 99. But then they are always, that's why we do something we call calibration and validation. Any instrument that comes in to be used, it has to go through validation, it has to be accepted to be used, and it has to be calibrated. Because before you run any test, that cartridge you're using or whatever equipment has to be calibrated, meaning that it should be able to measure what it's supposed to measure. Because if your instrument is 40, your actual blood might give you a glucose of 75, but the instrument might be measuring 200 and send a panic mode to you and to your doctor. So it's very important that we are lab people, we are doing our everyday cases to make sure our instrument is measuring what it's supposed to measure. And so the glucose may be 70, 93. My last year glucose was 93. And as he said, it's within the reference rate. So 93, I am safe. That doesn't mean I should be eating all the sugar I can think about. Well, like I said, we'll be going into each of the because we want you to understand the essence of this test. When you go and they tell you your urea is 11, of course, the range is 9 to 20, so you are within range. What does that mean? Your potassium range is 3.5 to 5.2. Mine was 4.7. I'm in range, so it's good. But then, so that when you go the following year and it's changed, then you know something is going crazy. If your A1C is supposed to be between, I think, a maximum of 5.6. If you go and yours is like 5.8, although it's not critical, but then it's warning you. I mean, luckily my A1C from last year dropped by 1. I say, yay, I did something good. And I was able to drop my A1C by 1 unit, But if it had gone up, then I have to take some measures. So it's very imperative that we know the numbers. Today, we might not be going through every single test, but then as time goes on, we'll take, let's say, potassium. What is potassium? And what is the range for potassium? If I'm getting a high potassium or low potassium, what does it mean? Sometimes they will tell you, oh, eat banana to get more potassium. But then if you keep eating banana, your potassium goes up to, then they will tell you, cut it short, reduce it, because eventually if it hits a maximum of, let's say, 6, then you are getting into a dangerous range. All right, Doc, let's talk about false positive and false negative. If a result comes out as false positive, what does that mean?
Yes.
Go ahead.
Yeah. False positive and false negative. Okay, so some tests are actually created in a way that you have either the result is positive or is negative. Whether the result is positive or negative. These are qualitative, results, so to speak, because when you have a result that is negative, that means the patient doesn't have the disease.
Analyze it, looking for, okay.
So if the patient is positive, that means that patient has that disease. So when it's false result, if it's false positive, for example, it's telling you that this patient is not up to the point of being negative, and the thing that you are using to measure it is telling you that the patient is positive, but it's not positive.
Okay.
You see that? So is the likelihood of let me put it this way, it's the likelihood of the measurement you are using, things that needs to come to play. We talk about predictive value of
Okay.
that particular,
Analyze.
reagent that you are using.
Okay.
Yeah, the reagent that you are using. Because okay, if this same reagent is able to measure a negative value, it should be able to measure a positive value before they even approve it to be used at all. But when, for any reason, and I'm going to mention two of those reasons that perhaps may allow a false, a reagent to give you a false positive result. For example, if the reagent is supposed to be out for 35 minutes at room temperature, and for any reason it's just been out for 10 minutes, and you use it that way, you see, the temperature might affect the result of the sample, you know. And also, if the sample is supposed to be at maybe at 37 degrees, let's assume if it's supposed to
Okay.
be at 37 degrees and the reagent has not been up to 37 degrees, which is room, body temperature at that
Yeah.
particular time, and you measure that sample, it might give you a false, positive or negative, result. So what am I saying in essence? When a reagent is approved for use in the lab, there are things that have come to play. For example, how many that has been positive to this reagent, how many that has been negative to this reagent. And in between, like I mentioned earlier, temperature and the way you have made the dilution, for the reagent for you to measure that particular sample. So if you have there are some procedure that are 2 steps, there are some procedure that are 3 steps. So if you skip any of the steps, you might likely get a false negative result. You might likely get a false positive result, depending on how you handle the reagent. So the way I'm saying this now might be confusing to some people, but this is what it is actually in real sense.
Hmm.
If you have a result that's supposed to be positive and
Okay.
it's now negative,
Negative.
and that is why sometimes they have what is called a confirmatory test,
Test. Okay. To confirm what
just
is.
to make sure that
Mm.
that false positive is not really, false
Positive.
positive. Maybe it's real positive. Now you want to know. And some of the confirmatory tests will take away some of those things that I've said earlier, because they probably will be using a different principle to ensure that whatever stages that have been skipped earlier is not, continue in this particular test that you are doing. So, for example, I will take HIV. For example, HIV is being measured by the instrument. For example,
Okay.
let's say by Abbott instrument. If that HIV result comes out as maybe it's giving you a value of 1.0 or maybe 2.0, and but it's
Okay.
showing on the instrument that is positive, uh, I probably would know that, well, if it's positive, then that means the concentration is really low. But I want to make sure that this guy really has HIV.
The
So I
virus.
have
Yeah.
to go to do more, what we call a multi-spot test.
Okay.
That's a confirmatory test to ensure that that positive that I see there might not really be positive. It might just be something that is, and that is why sometimes you have to spin the sample down again, making sure that it's well spun
Span.
before
Okay.
you now test again. So
No
those
interferences.
exactly. So to take care of the interferences, so that you can make sure that this test that you are now doing now is actually, and sometimes when you do that, it comes back as negative. This one that has
Hmm.
been positive with the instrument, is now when you now do the confirmatory test, it now tells you that it's negative.
Negative.
So the false positive and false negative, like I said there earlier on, are usually come up when we're dealing with qualitative tests in the lab.
Wow, awesome, Doc. Very well explained. I really love the explanation. And this reminds me about a joke I played on my neighbor when I was in the Navy in Florida. Oh Lord, I hate this joke, but I hope Heather is not listening. But Heather used to be our neighbor in Milton, Florida, and at that time, that was around 2000 when I just finished lab school. So Heather wasn't ready for pregnancy. She didn't want to get pregnant. You mentioned pregnancy. She had a dog. She and her husband had a dog, and she loved the dog to heaven. She wasn't ready for pregnancy. So working in the lab, Heather came one day, and of course, he came to do her. I mean, they put some labs in for her, and she came to the lab. I drew her blood, and you know what? That thought just came to my mind. I had done QC. You know, we do QC on ACG pregnancy test. It's just a kit where you have two qualitative reagents. You do your, I mean, the QC, you put the drops in, and if the patient is actually pregnant, it will show positive across or sign or something. And so it just, some silly idea came to, let me prank Heather. And so I used, please, I don't do this in normal life. It was just a prank. It was a prank. So I thought I was going to prank Heather. So I took the QC, the positive QC for ACG, that shows that somebody is pregnant. Instead of putting her serum, her blood that was in front, of course, I had done actual test, which was negative in the kit. That was what I reported in the lab. But I took the QC, used another kit, and then I took the positive reagent, put it on the kit, and it showed positive. And I wrote her name there, Heather, so. And I said, Heather, good. I said, good. Congratulations, Heather. She said, just like those different world comedy. Charles, what you talking about? I said, Heather, congratulations, you are pregnant. She said, Charles, stop fooling with me. I ain't no pregnant. She started cursing and swearing. She was so mad. I said, Heather, calm down. You're just going to have a baby after 9 months. It's nothing bad. She was mad. Oh Lord. I said, her face went red. And then she was ready to bump out of the lab crazy. I said, Heather, don't you want to have a baby for us to celebrate? No, Charles, I'm not ready. And then the first thing I said, Heather, I'm just joking. I pranked you. I mean, your actual results in the lab computer is negative. She said, Charles, I'm going to kill you. Oh, so this is something that is just like, false positive. She wasn't pregnant. Her kid wasn't positive. I pranked her, and it shows. So this was a false positive. Something like Doc was talking about. I mean, it was funny, but then, I mean, she almost had a heart attack. I said, Lord. And later, I told my wife, she was busting out laughing. So just like Doc was saying, if you put out this information from the, it will tell you, so, okay. So it says some test results tell you whether a certain substance, germ, type of cell, or gene was or wasn't found in your test sample. On your test report, you may see these terms, okay, negative or normal. This means, no, the test didn't find what it was looking for, just like Doc said. So you are unlikely to have the health problem you were tested for, but you may need more tests. Positive or abnormal, this means, yes, the test found what it was looking for. The germ, substance, or gene being tested was in your sample. So you may have a disease or infection. In certain cases, you may need more tests to confirm a diagnosis. Inconclusive or uncertain, this means not sure. Your test results clearly positive or negative. There are many reasons why this may happen. If you get an uncertain result, you will probably be tested again. So let's say when we say test for COVID virus are an example of tests that tell you whether or not a specific germ was found.
I say invalid.
Invalid or something. So, so when we test for like the COVID, if you go for your COVID test and it's okay, your test is positive, which means they found an antibody that was reacting to whatever is in your system. So your body was producing this antibody. That's why your results became positive. It wasn't there, it wouldn't show whatever they were looking for. So pretty much, it's very important that when labs are given out, you have to know whether it was positive, negative, and like I said, Doc said inconclusive, which means you can't report that. I mean, sometimes we run labs that tell us it's indeterminate, which means it's not positive, it's not negative. And it all has to do with what? Again, knowing your numbers. That is why it's very important that you know your numbers, because if you run, let's say, HIV, and let me just take an example. Okay, let me use the glucose example. The reference rate, let's say, 70 to 99. and your resource was 69. It's lower than the range, but in this case, it's not going to harm you. But in case of HIV, if the resource has a reference rate of, let's say, 1 to okay, 0 point something to 1 or something, and your resource doesn't fall into that, it's indeterminate. So either they have to run the test again. In this case, either the QC wasn't done well, either the instrument was misbehaving, a whole, or maybe interferences in the blood sample, which maybe they have to spin again, and also so many things. That's why it's always very good that such results are tested again to make sure what you are reporting is legit, because you don't want to give any patient results that are not akin to the person's internal organs. If you give a wrong result to a doctor, that's what he's going to, treat. And we have when we were working partner together with Dr. Oluyede, we had a doctor. I'm not going to mention his name. This guy, when you give him lab results, he will question the results to hell. He said, "Are you sure? Are you sure? Is your instrument working?" This guy will come to the lab. I'm just looking at the doctor's face. He will come to the lab. "Are you sure?" He wants to come and see the results himself before believing. If it's a diff, he wants to come and read the diff himself. How many lymphocytes do you see? I mean, some doctors are like that. They don't even, believe, but it is what it is. So it's very important that labs are reporting the right results, because they can affect your results. And maybe quickly, we have 8 minutes more. I think the last time, Doc, we went over what can affect the results, like eating and drinking certain foods. I think we mentioned that.
Yes.
Taking certain medications.
Taking certain medication.
Yes. And when you exercise too hard before your test, and then having a menstrual period at the time of your testing can also affect you, because if you are in your menses and you go do a urine sample, guess what? Your blood is going to be
high.
Your urine is going to be very bloody. And so when you bring it to the lab, we can't even see anything under the microscope. It's all red cells. I mean, that's why we use the term too numerous to count. I mean, the microscope is even confused. Your red cells are so many, they can't even read them. So you can't quantitate and give it a number like, low power, high power between 0 and 5. They are too many, because you are menstruating and your urine has a lot of red cells. So the microscope just got jammed. It's all full of red cells. So in such a situation, then we may have to spin the urine and do some skirmishes, to get something close to what it is. But then, so when you go to the lab and you are in your menses, please let whoever is drawing your blood know. They put a
let them know.
Patient is on mens, and so whatever results come out, it's not a total, an accurate reflection of what happens to your body every day, except on those conditions. All right, let's see. Doc, let me take a quick ad, and then we'll come back, because I think I've made you talk too much. All right, let's take this ad quickly.
Hello, beautiful people of Ghana. This is Banahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Banahine Specialist Hospital, our extraordinary physicians and nurses are here to provide a high quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs, and you will be happy you did, because we believe the health is wealth. Thank you, and stay blessed.
Excellent.
All right. You are still with us with Era One Radio. We are broadcasting live on Facebook, YouTube, and also on Modern Ghana Radio. Please don't keep this information to yourself, because not many platforms discuss this. I mean, to have Dr. Oluyede here helping us discuss this thing is very, very crucial and very, very important to us. So please share the information. Go to YouTube, it's there. Go to Facebook and type in Era One or type in Health is Wealth. You see my name there. You see Dr. Oluyede there. Share. This is very important. We want to educate, at least the least we can do with our education, having this PhD in public health, is to share our knowledge. Of course, you didn't pay our tuition for us, but then we want to share our knowledge with you. We want to help. Whatever we studied or we learned, we want to share and make it a communal importance. So tonight we've been looking at what is BMP, Basic Metabolic Panel. We'll be going to the CMP, the comprehensive, the one that is more details. And we also looked at what is needed for Dr. Loyede mentioned that why we need to do or get our labs done for BMP. And then why do I need a BMP? We also discussed that. We also look at what the results mean. What is your actual results and what is the reference? Your results will be there, but then how does it compare to the set range, the reference? If it's not within the range, then you have to do something about it. If it's below or above, because sometimes even having a result that is below the reference range can also be a problem, because they have to still either give you medication to bump it up or do something, because it's either it's within or it's outside of this periphery. So something must be done. We have to do something to bring your results to optimum. And by God's grace, by nature, nature has a way of bringing our body system to optimalization. We call it homeostasis. If I mention the word well, homeostasis. It has to do with temperature. God has set our body temperature to 37 degrees as the optimal normal. So anytime your temperature is too high, they say you have a high fever. And anytime you are too cold or something, the temperature is down. So nature works to bring your temperature within the set limit. If you are too cold, your body, takes you have to take all the fats in your body to increase your temperature to make sure it's meeting that optimum temperature. That is why for those of you who go to IVF, you realize that when they take the sperm and they take the egg, they put them in a petri dish, they subject them to human body temperature, 37 degrees, incubate them just like it would have been a normal body temperature. And those little bad boys and bad girls, sperms and egg, still fertilize and they grow because of the temperature they've been subjected to. And it's eventually inserted into a human being who will also maintain that same. Can you imagine these sperms and egg grew in, let's say, a temperature of 29, and then you subject it to a human temperature of 37. Can you know what is going to happen? They cannot survive because that is too high for them. So they subject them to the same temperature and they are able to survive. So, well, Doc, thank you so much for availing. I know you had to sacrifice. You had to get rid of something to make this happen. You score opportunity cost. He lost something so that we will gain something. So, Doc, well, we are wrapping up. We have 3 minutes more. What is your closing remarks? What advice more do you want to give us?
Yeah, I just want to thank you for having me, and also I just want to uh, encourage our listener to please take care of their health. Do it while you are still alive, because when you are gone, there's no reason for it anymore. So please take care of your health, monitor it, talk to your clinician, educate yourself also, so that you know what you are asking. And when they give you the answers, you know what to do with them. Thank you so much. I look forward
Thank
to
you.
seeing you next week.
Thank you very much, Doc. Yes, by all means, if the Lord doesn't come and the rapture doesn't come, we'll maybe make time to meet again next week. All right. I know Doc did his dissertation. He did a very good study. As time goes on, we'll be discussing what he did for his study and what made him a doctor. We'll do that because when you do your PhD program at the end, they want you to do a paper, do a study, something that you put your hands on, you mastered, you measured. Something you can say, okay, I did this, and so you write a dissertation, and your chair, whoever is okay, based on whatever you wrote, we accept you, we give you the degree, we confer in you. Now you can put the letters behind your name and walk around with your shoulders high up. Yeah, I made it. Yeah, I got the PhD and all those letters. Well, I studied. I did a relationship between family income and obesity. How does the income that the government gives you or whatever money you make, how does that affect you in terms of obesity? Does more money make you obese or low income make you obese? That is what I put in this book. I didn't want to keep it to myself. I put it in the book. It's still on Amazon for only $10. Support the brother. Go there and get a copy and help us to write more. That's it.
Yeah.
It's still on Amazon, so get a copy. Next week, we'll be talking about Dr. Loyede's dissertation and all that he's done to help this world a better place than he came to meet it. Doc, thank you very much. My regards to the family. Tomorrow is Mother's Day. Please don't forget to wish your mothers happy birthday. Happy Mother's Day. Go to church and celebrate them. Let the women feel big. If you've been saving this time, please get a flower for your mom, or it doesn't have to be your natural mother. It's not everybody who is a natural mother. Some women were born only to take care of other children. They never came to through their bodies, but they are still mothers. And for some, even they were more motherly than the real mothers that begat them. So show love to a mother. Your daughters are still mothers, even though they are potential mothers. They are all mothers. Yeah, let's appreciate our mothers, because I mean, being a mother is a job that we can't even pay them. So we say their paycheck is in heaven. I had a poem I was going to.
The paycheck is in heaven.
Heaven, yeah. I had a poem I was going to dedicate to all the mothers, but I think our time is gone. So maybe I'll have to do it next time. Doc too has to leave. So Doc, thank you very much. I will
Thank
see
you so much.
next week. All right. Bye-bye. Have a good time. Thank you very much. Bye.
C'est mon père, ça me fait bien tiens. Tu me fais dire non tout, era one radio. C'est mon père, tu me fais bien tiens. Tu me fais dire non tout, era one radio. Oh, and you pam chima, chintu, asam pam chima. I got one chima, era one, yebo numpam kuma.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common BIA says the dead, as in Takre no assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and on Taibo channel. Kaise, so we see the real in common getting what brabon tete, we nyan konkonsa, we the real in common getting.
Kosua na ti Era One Radio, empenyini say, yensoma na motenten, yesoma banyasafo, Era One Radio. Yedin sem anumuaye ebrem.
Aden urefiana Seo to me manya eni about Aden wasua mani suwa fosunyade Aden meba Aden kra Eya useni da suasa Eni da suasa Eni da suasa Eni da suasa